On World Blood Donor Day, Canada continues to face a shortage of supply amid high demand for the life-saving fluid. According to Canadian Blood Services, there are about 150,000 open appointments for blood and plasma donation as Canada's inventory faces challenges. The organization says blood donor behavior has changed over the course of the pandemic, which is affecting donor attendance and appointment bookings. It also says that 1 in 2 people in Canada have required blood or blood products or have had a loved one who has. And although 1 in 2 people are eligible to donate blood and plasma, only 1 in 81 does. Meanwhile, certain myths around blood donation can be contributing to a fear of or lack of interest in providing this life-saving donation. Well, joining us now to help dispel some of these myths and address concerns around blood donation in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here.
So to get a better understanding of the demand here, how often is donated blood used in a medical setting? And do we have any numbers behind this demand?
Right. I mean, donated blood is very frequently used in medical settings, and certainly we look at it in terms of emergency and both planned procedures as well. Blood transfusions are extremely common, and especially when we look at severe injuries, managing blood disorders, and even providing support during chemotherapy and radiation treatments to cancer patients, we certainly need blood. Certainly, we also look at addressing complications during childbirth and that demand. So if you look at statistics, especially in the United States, they do say that every 2 seconds, someone in the United States needs blood or platelets. So we see something very similar in Canada as well.
A very high demand, Dr. Rout. So do we have enough donated blood to meet this demand in Canada?
I think that's the issue here. What we are seeing is there's been a lot of changes in the way we've managed things, especially during the pandemic, and people have become a little bit scared to give blood. So certainly that has caused a lot of challenges for us. But in the meantime, what we would want to do is certainly urge people to donate blood, especially for today, which is the World Blood Day.
Definitely, Dr. Rout. Now, addressing some of these concerns here, a lot of people might think, what sort of difference could a single blood donation make? So, for some perspective, how many lives can a single person's blood donation help, Dr. Rout?
Yeah, I think that's a great question. I mean, if you look at just a single donation, you can separate that into red blood cells, platelets, and plasma. Each of these components can be treated, given to different patients and in different medical conditions as well. So potentially, even with one single donation, we're talking about saving potentially 3 lives by providing the components that they need.
That's quite the impact, Dr. Rout. Now, another common concern around blood donation is the amount of time that it could take to donate. So, can you walk us through the process and where and how people can go about donating blood?
Right. So time is certainly a concern that people have, but it really shouldn't be. A person can arrive to the donation center. They get a quick health questionnaire to make sure they're eligible, a very quick physical examination with vitals, blood pressure, and then a quick check. And then, you'd go ahead and provide the donation. It takes about 10 to 15 minutes. After resting for a little bit, you have a light snack and then go home. Typically, the total procedure takes an hour.
Sounds pretty straightforward. Now, another concern that I've come across is the donation potentially depleting a donor's own blood supply and potentially weakening them or their immune system. So, is there any logic to this concern here, Dr. Rout?
Right. We hear that concern quite a bit, but the human body has a remarkable ability to replenish blood very quickly. So really, the important thing here is it does not deplete your own blood supply significantly, and it certainly does not weaken your immune system. Any of these short-term inconveniences are exactly that, short-term inconveniences, and very quickly you are back to normal.
All right, Dr. Rout. And there are concerns around donating blood while on certain medications. So, what are some of the limitations to consider when it comes to this?
Right. So I think when we look at it, there are certain medications that are contraindications, but typically in those health questionnaires, we're able to see which medications would be a concern. More often, it's medications that treat infections or autoimmune disorders. But more often than not, if you're on a medication, it's more than likely you are fine to donate blood, and we just look at that on an individual basis.
All right, Dr. Rout. And what about conditions like high blood pressure and diabetes, which impact many Canadians and may affect interest in donating blood? So, are there any concern, or are these concerns justified?
Right. As long as these conditions are well managed and under control, there's really no risk with that. We have a lot of people with high blood pressure and diabetes who do donate blood on a regular basis, and sometimes it's actually helpful. I had a patient recently that we actually recommended donating blood to bring down their ferritin levels, which for men can also cause issues with diabetes. Sometimes it's actually beneficial for these patients.
Always a helpful interview, Dr. Raut. Thank you again for your time today.
Thanks so much for having me.
Stay with us. We need to go to break now, but we'll be right back. And when we return, we're going to be taking a look at important news from across the country as Bell is cutting 1,300 jobs and closing 6 radio stations. That and more up next.